Dockies, this is Doc Jean and welcome to Dental Life. On this video, we will be discussing on how you can convince your patient to want what they need as you suggested in your treatment plan. Now, basically, mga Dockies, this is very, very important because most of the time, we are hindered by our egos or hindered by the wrong mindset, thinking that as a dentist, we should only deal with treating the patient. Because as I've said, we have a convoluted way of defining service and defining what we actually do. Mga Dockies, you have to accept the fact that the moment you paid rent, that the moment you invested to have a clinic set up, you bought equipments, you pay people for their salary, give benefits to them, and run the entire thing, it now becomes a business. And to say it otherwise, you are fooling yourself. Now, mga Dockies, if you are just happy with what you have, then that's fine. It is okay. But the thing is, why are you hindering yourself to really grow and be the best that you can? Why? Don't understand. That is why I am offering a lot of, the Dockies who watch and follow me here in the Dental Life channel is for you to try and check out. And if you like it, enroll in the program Smart Management Dental Life, because I will try to make sure you achieve the goals that you have in your mind. Now, the thing is, mga Dockies, I can only accept 20 dentists because this is not like any other program that after the lessons itself or the schedule itself, you are on your own. This one, I will provide support for at least 12 months in order for you to achieve what you want to happen in your dental life. Kaya lang, mga Dockies, kailangan committed ka. Kasi kahit anong gawin ko, kung hindi ka committed, walang mangyayari. Di ba? At any rate, these are the things that you are going to learn in the program. But I will give you one important tip in order for the patient to be convinced to want what they need. Alam niyo mga Dockies, sa totoo lang, before, after my treatment, I always trained my assistant. Once I stand up and finish the treatment, I have to hide and find somewhere else that the patient cannot reach me so that my assistant will be able to handle the financial matters. And then I come back for the post of instruction after the patient has paid the bill. Now, it works for a while, but in all honesty, it doesn't fly. Because at the end of the day, especially in the way our market goes here in my country, in the Philippines, is that you really need to know how to sell dentistry. Now, to clarify what does it mean, it doesn't mean na mambobola kayo. It does not mean that you will do a treatment plan more than what is needed by the patient so that you can earn more, or you will overcharge, and all these things. Actually, do watch the video that I created about how to avoid bargaining with your patient. Eto mga Dockies, what I can really suggest to you is to have an empathetic yet firm stance when discussing these things to the patient. And it should have been discussed prior to the treatment. And because you watch that video that I mentioned, you will understand why transparency is very important. Another thing that will enable you to really make the patient want what you are offering. Kasi minsan, ang ganda ng offer nyo, ang ganda ng sinasabi nyong treatment plan, but in the end, the patient doesn't want to continue just because of the price. And this is the reason why it is very important that you know how to communicate properly to your patient. That is one key of making your patient want what you are suggesting and what they need to have in their treatment. Another thing is that you have to understand or have an idea of human behavior. You have to utilize a certain psychology when you are selling. And that is the reason why you need to learn how to sell your service to your patient. Mga dokis, let's stop, thinking about our ego, that we're above these things, that as a doctor, you shouldn't be discussing money matters, or as a doctor, that's too cheap to discuss. But you see, mga dokis, it is necessary. If we can inject patient, open up their gums, do all the hard stuff inside their mouth, how come we are too scared to really put value on what we are doing and what we are trying to suggest for the patient to have that treatment that is necessary in order for her oral health to be better? Alam nyo, mga dokis, at the end of the day, this is something that you have to accept in order for you to be able to encourage your patient and do what they need. If you like this video, mga dokis, please support Dental Life. Give me a thumbs up, subscribe, hit that notification bell so that every time I upload, you will be notified. And of course, I would really appreciate if you are going to comment below and let me know what other topics you still want me to tackle in Dental Life, so that I will be able to at least give you something in order to create, build, grow, and sustain your dental life. Always stay safe and be healthy. Bye!